Okay, moment everyone's been waiting for, Gardasil.
All right.
Going through the Gardasil. The main reason that we're really passionate about this is because we're just, when we put a call out for interviews, Gardasil's just coming in thick and thin, and we're seeing horrific stories on young girls and boys of the most awful damage. Now, so I have here the Gardasil 9 insert, the actual real thing that comes out.
Yes.
First thing is glaringly obvious. Is there's a pair of scissors there with a line, and this is supposed to be given to every patient about to receive the Gardasil, and it's supposed to have gone, the healthcare provider, your doctor, your paediatrician, says, read this information with care with your patients. So that's really, really clear. So I have yet to meet anybody on any vaccine that's actually been given this little tear out bit here.
Right, and then the doctor is supposed to read this and understand the larger prescribing information.
The doctor's supposed to do that. And so clearly when you just glance through this, a couple of things stand out to me, and that is the side effects, which are the usual sort of swollen glands, joint pain, tiredness, chills, generally feeling unwell. But for me, big one as always, seizure. Yeah. Seizure is a side effect that's even written on the little summary here. So that's, in my brain, how common that is. Fainting. These are the things we're hearing about from many, many patients, the seizures. And the seizures aren't just a one-off seizure, they go on and on and on. So that stood out. And then, of course, down here, simple question, can I get Gardasil 9 with other vaccines? Gardasil 9 can be given at the same time as a meningococcal vaccine, and the DTaP is what they say here on this piece of paper that comes. So no flu vaccine, none of the other things that we're hearing that have been given at the same time. That is not recommended anywhere in the insert to be given at the same time as Gardasil 9.
That's what I have, and when I look at the, this is just the printed out version of what you have because I can't see that little print. So I have the printed out version, and at the very end it talks about how they did the studies with those two vaccines, and they found that they got a good antibody response from Gardasil, even with giving those two. Now, in this particular paragraph, it doesn't talk about safety, it just talks about immunogenicity.
So in summary, they don't really know.
I'm not recalling, it may be in here, but that's not something that I focused on when I read through the entire thing, was the safety while giving it with these other two vaccines.
The other thing that jumps out on my insert for me, well, nothing really jumps out because the writing is absolutely minute, but what does post-marketing experience actually mean? And what are they saying when they say that?
Well, so you have to understand how the clinical trials are designed in order to understand post-marketing experience, because I think that's important. When they are looking for volunteers for these studies, they have certain exclusion criteria. If you go onto clinicaltrials.gov and look at, just pull up any study and you'll see that there are exclusion criteria. And they do this with babies as well. So say you are on an immunosuppressive medicine, or you have severe anemia, or you're being treated with corticosteroids, or some other kind of chronic medical problem, then you're not eligible to be in this trial. So in the end, what they have are fairly healthy people that they're trialing this vaccine on, and then they give it to everybody. And then, so the post-marketing experience is what happens after it's actually used regularly in the larger population, and people reporting the adverse events.
So our children of today, could they be post-marketing experience?
That's right. And if I recommend that people go to a website called SaneVax, SaneVax, and there's a document there where they talk about the post-marketing experience, and they talk about the following adverse events have been spontaneously reported during post-approval use of Gardasil, and because these events are reported voluntarily from a population of uncertain size, it's not possible to reliably estimate their frequency or establish a causal relationship. So this is what Gardasil is saying. So these are some of the post-marketing experience adverse events: blood and lymphatic system disorders, autoimmune hemolytic anemia. That's something you don't want to get.
Right.
Idiopathic thrombocytopenic purpura. That's another thing you don't want to get. Lymphadenopathy. That's okay. Respiratory, thoracic, and medius pulmonary embolism. That's another one you really don't want to have. Nausea. Okay. Pancreatitis. That's a baddie. Death. Yeah.
I love that.
They put death in between chills and fatigue.
They sneak it in. They sneak it into, we see in there.
Although there were deaths in the original trials, which we can talk about. Autoimmune diseases, anaphylactoid reactions, acute disseminated encephalomyelitis, another baddie, Guillain-Barré syndrome, which pretty much happens with, just about any vaccine, motor neuron disease, paralysis, seizures, and transverse myelitis.
Transverse myelitis.
That was called polio in the 1960s. So these are some of the post-marketing experiences, and this is why we recommend that people, even, if you're going to have your child or you're thinking about getting this vaccine, to at least just look down the package insert, go to Sane Vax, read around a little bit, go to the CDC, read what the CDC has to say, read around the package insert, and develop some questions to ask your doctor. Or develop questions that you can go online and answer yourself, because whether or not someone wants to make fun of you for Googling, it is the largest library that's ever existed on the face of the earth. Okay, let's just go back. We have Gardasil, which had the 4 antigens, which was released in 2006. And because it was very successful at eliminating those antigens in people who were vaccinated, but what happened was, because nature hates a vacuum, is that other cancer-associated viruses cropped up in that empty space. And so now they said, okay, well, we have to expand. This is what happens. This is a common problem in vaccinology. So they had to expand the amount of antigens from 4 to 9 in order to compensate for that. So now we have a new Gardasil. So it's not Gardasil 1 and Gardasil 2. It's Gardasil is the old one, and Gardasil 9 is the new one. The other thing I want to point out is something that Sane Vax outlines very nicely here, which is that normally when there's a new vaccine that's different, it has to go through an approval process with the FDA. And so what happened here in 2014 is that the FDA improved the use of a reportedly new improved version of Gardasil without consultation with the Vaccines and Related Biological Products Advisory Committee. And the reason for bypassing is that they said that the review of the information didn't raise any concerns or controversial issues which would have benefited from an advisory committee discussion. So it was very rapidly brought through the FDA without any rigorous scrutiny. And why this is alarming is because there are radical differences between Gardasil and Gardasil 9. And they're pointed out. For some reason, this chart got duplicated on their website. And this is true, I checked it. So I'm not just going to Sane Vax, I actually checked their information, and it's 100% true. So in Gardasil, there were 225 micrograms of aluminum per injection, 3 injections total. In Gardasil 9, there's 500. So that's more than double.
I flagged out here. Why would they do that?
Well, they have more antigens, and perhaps they want it to try to make it last longer in the body. They want to cause more of an inflammatory response. Your guess is as good as mine. So all the background substances, which are actually also very important, which we're going to get into in a while, because everyone, they want us to think that L-histidine and polysorbate 80 and yeast protein are benign substances that we can inject, as much as anybody wants with these vaccines, but it's not true. Now we always had the HPV-6 L1 protein, but they've increased the antigen from 20 micrograms to 30 micrograms. So that's a difference. That's a 1.5 times, right? So they kept this particular HPV-11 the same. They increased the number 16 from 40 micrograms to 60 micrograms, and they increased the 18 from 20 micrograms to 40 micrograms, and then they added 1, 2, 3, 4, 5 new strains. So you tell me that this is the same vaccine that can be pushed through without, further scrutiny.
Is there anywhere that says they've done safety studies on the 9?
Yes, that's what this is about, and
other than rats.
What they're doing is they're basically doing what's always been done, which is to say, well, this was generally regarded as safe, so this is also going to be generally regarded as safe. Just like aluminum phosphate is generally regarded as safe because all aluminum is generally regarded as safe. So now this new super aluminum called amorphous aluminum hydroxyphosphate sulfate, which is kind of a new, very scary, in my opinion, kind of aluminum, is also considered safe, although I can show you why it isn't safe. So they basically increased the total amount of antigen from 120 micrograms in Gardasil to 270 micrograms in Gardasil 9. They doubled the amount of aluminum. They have the same amount of injections, and they're giving this vaccine to people who have already had the original Gardasil.
Except it does say here that if you've had any kind of reaction to the first Gardasil, you must not have the Gardasil 9. So that's in the tiny weensy writing in here that no one would ever know. It's very kind of them.
They also go over the serious adverse events here, and they compare Gardasil to Gardasil 9. And they make it look like, this is directly taken out of this package insert here. So Gardasil had 2.5% of serious adverse events. Gardasil 9, 2.3% of serious adverse events. And you would think, well, that's not so terribly bad. But for every 100,000 people using Gardasil 9, there will be 2,300 serious adverse events. And this is the kicker, is that the cervical cancer diagnosis rate in the United States is 7.9 per 100,000. Basically, the risk-benefit ratio obviously should not favor giving this vaccine.
It makes no sense.
Given that it's a slow-growing cancer. And maybe we should review cervical cancer a little bit, because I did that. And I've done it. I have a video that I did in Sweden a couple years ago that people can go look at as well, which has more detail.
On YouTube, they can get it.
On YouTube and on my channel. So, cervical cancer is, it's not all related to HPV, and there are studies that show that they can find tumors. It's less common than finding HPV, but it does happen. And we also find cervical cancer that doesn't have these particular strains that are in the vaccine. But in general, it's a slow-growing, slow-evolving change in the cell, which is called cervical intraepithelial neoplasia, CIN1, which isn't cancer. It's a change in the cell morphology or how the cells look, and it's not good. You don't want it. But the fact of the matter is, it is related to HPV, but it also is related to having low vitamin D levels, to smoking, to having multiple sexual partners. So there are other factors that actually you can change, improve your nutrition, improve your vitamin D level, stop smoking, that is proven to actually make a difference. But if we're just going to focus on HPV and CIN, what people need to know is that if you have CIN1, there are 3 stages of CIN. If you have CIN1, 70% of those regress, meaning go away, the HPV goes away, the change in the cells go away within 1 year. 90% of them will be gone in 2 years, okay? CIN2, 50% of those will regress in 2 years, and many of them will regress as time goes on as well. CIN3, it takes longer to regress, and fewer of them regress. And then you can move on to carcinoma in situ, and then invasive cancer, where the cancer can grow into the walls of the vagina or up into the uterus, and so basically locally invasive. And again, there's no good such thing as a good cancer. But as far as cancers, this is not one that's going to take you overnight. And we've proven that the cancer is being caught so much more, 70% decrease in cancer since we've started doing pap smears and regular examinations. So I think that that's just important information for people to know. And the other thing is that we're recommending this vaccine for people between the ages of 9 and 26. And what we need to understand also is that the typical age of CIN, these changes, is 25 to 35, and that the antibodies, at best, are lasting 8 years. But in many cases, what I've reviewed in the bigger document is that for many of these strains, they're completely gone after 4 years. So we're vaccinating these young kids for a cancer that they're not going to have, more than likely, until they're 25 to 35, and by that time, the vaccine effect will be worn off. So I think that if there was a vaccine that was safe and effective, I wouldn't be giving it to people that are this young. But they think that if they get in there with the vaccine early, that they can prevent colonization with these HPVs, which is also absurd, because we know that babies are born with these HPVs. We know that they can get them from the father. We know that tonsillectomies have them in the throats, and we know that they find them all over the body in humans at all different ages, including at birth. So the real problem with that is that if you already have a strain in your body of these cancer-associated HPVs and then you get the vaccine, you have what is called negative efficacy of the vaccine. It's a very undesirable situation because you can actually develop cancer as a result of getting the vaccine when you have the HPV in your body.
And that's hugely important.
Very, very important.
Nobody knows that. I mean, and tell me what's their thinking behind the boys getting it then?
Well, gender equality, and also the fact that boys are carriers. And so if one boy has sex with one girl and then has sex with another girl, he can spread it from that girl to that girl. And he can also develop penile cancer, warts, anal cancer. If he's gay, he can be giving cancer and warts to his gay partners. And so they just think that if they're using herd immunity as the reason, and they're actually showing studies that they are decreasing the amount of carriage of these HPV viruses in certain populations that are taking up the vaccine. That's all fine and dandy if it wasn't for the problem of original antigenic sin, where we've shown significant problems. And I've reviewed this, and I'll just show you some slides that demonstrate what I'm talking about. So this is the original Gardasil, okay? And so that was replaced by the new one, which has all these new strains and extra aluminium. Sorry, I gave that talk in Europe. And each series, again, is 3 shots. And what they found in this study by Guo, and I have a PMID number here, 263-76014, is that HPV vaccination was effective against all 4 vaccine types in young women vaccinated after 12. However, vaccinated women had a higher prevalence of high-risk non-vaccine types, suggesting that they may benefit from newer vaccines covering additional types. So that's what I was just talking about, strain replacement. So we're seeing vaccinated and unvaccinated. So the vaccinated, the blue lines here, have some of the high-risk non-vaccine types you see much higher than the unvaccinated. So that was a problem. So they said, okay, we've got it under control. We're going to create this new vaccine. So they gave it to people who had had the old vaccine and to people who hadn't had the old vaccine. And the difference is also interesting. And this article by Chakradar, in 2015, PMID 260-46565, showed that if you had the old vaccine and you got the new one, your response rate was 25% among those who previously received Gardasil, but the response rate was 63% in people who received Gardasil 9 alone. And that's due to a term called original antigenic sin, also called linked epitope suppression, and it's very well defined. I mean, I didn't make this term up. This has been around since the 1950s, where the immune system responds according to its original training. So while it was trained to go after Gardasil original, it's still programmed in that way, so it's having an inferior response when you give it a new challenge with different strains. So this is a problem with the new vaccine giving to people with the old vaccine, in addition to the fact that it had what I am calling negative efficacy in the original trials. And I can show you that if you want to see that. So they basically did this study where they used Gardasil and placebo, but we'll get into that it actually wasn't a placebo. Man, it's amazing how they define placebos. And I'll show, I mean, it took me so long to dig out what these placebos really were. But what they found was they gave the HPV had strains 6, 11, 16, 18. And in these girls, the endpoint was developing CIN 2 or 3. That's the second or third stage of CIN. And they found that it had a negative efficacy, minus 44.6%. Well, that means that they were developing cancer at a much CIN at a much more rapid rate than the girls who had the placebo, which was either the background solution of the vaccine or amorphous aluminum hydroxyphosphate sulfate, not saline like it says in the FDA documents. And what's interesting is they kind of fob it off as saying these women were significantly more likely to develop high-grade markers for cervical cancer. And then the FDA says they conclude that there is compelling evidence that the vaccine lacks therapeutic efficacy among women who have had prior exposure to HPV and have not cleared previous infection. So they're basically, in a sense, blaming the person. And the problem here is that if you were to go, say you're a 20-year-old and you go to the gynecologist and you get your exam and they offer you the HPV vaccine and you say, well, I'd really like to be tested for HPV first to see what strains I have, because if I already have the strains in the vaccine, I don't want that. Well, they're not going to be willing to do that for you beyond the normal HPV cervical testing that they do.
Why would they not be willing to do that?
Well, probably because it's too expensive. It's not recommended. I mean, the FDA and the CDC basically say, no, we shouldn't be doing baseline testing. Okay. So if you're going to give a 9-year-old, they're not going to test her for HPV beforehand, certainly. So
a 9-year-old of today in America, and indeed around the world, is the Gardasil 9 what they will get if they go in?
Yes.
Is anyone using the old Gardasil vaccine now?
They didn't remove the old Gardasil from the shelves. This is also another interesting one. You know, that just struck me this way today is that, you know, we're told that, you know, when there's a problem, we need to get a vaccine. And when it comes to Gardasil, they're saying, just give any vaccine. It doesn't matter. You can give Cervarix, which only covers 2 cancer strains. Or you can give Gardasil Original, which covers 4 strains total, 2 cancer, 2 wart. Or you can give this new one. It doesn't matter. They say, just give something. No, that doesn't make any sense at all, because if the problems are these new strains that are cropping up, then everybody should be getting Gardasil 9. But that would mean taking all these other ones off the shelf and taking Cervarix off the shelf, which they should do, in my opinion, because it's made on caterpillar
So you don't know what
ovaries.
you're getting when you go in unless you ask?
That's right. Please ask, and please do your research before you accept it, because Polly and I have seen so much horrible vaccine injury. And I want to show you something when it comes to this horrible vaccine injury, that it's not just our imaginations, that this is a bit of an older slide. But what it shows you, and this again is from SaneVax, where they got the vaccine adverse event reporting system data. And so the blue bars here show the reports for all the other vaccines that are not HPV vaccines. And the maroon bars show you all the reports that were just for HPV vaccines. Now, if all things were equal, meaning the ratio of adverse events would be the same for HPV versus the other ones, we should see the maroon bars down here. But we see the HPV maroon bars up here, and in some cases, look at this, disabled. Look, it's like 1/3 higher amounts of disabled reports of HPV vaccine compared to all other vaccines combined. Look at this, infertility, look at that.
That's what we're seeing.
Yes.
That's the main thing. I mean,
Yeah. Abortions,
powerless.
extended hospital stay. So in every case, it's higher than it should be proportionally.
It's a wicked vaccine.
And the problem is that when you get a vaccine injury with Gardasil, none of the doctors will recognize it. It's very rare that someone will recognize it as Gardasil related. So they're basically blindly stabbing in the dark, trying to treat you without acknowledging what actually hit you. So it's basically like being run over by the bus and being treated for a mosquito bite, or even worse, being, bitten by a snake and being treated for a heart attack, because they don't know what they're doing. They don't understand the pathophysiology, so they can't possibly treat it, even if they did acknowledge that it was from the vaccine. So this is a major problem. We're seeing girls that are type A personalities. That's what you're seeing, right? Hockey players, cheerleaders, straight A students, who are doing everything, and all of a sudden they lay in the bed all day. The mother can offer them the credit card to go shopping and do anything that she wants, and she just says, no, I can't.
But that's also showing signs of menopause, where the hot flashes everywhere. These are 15-year-old girls.
Well, the infertility rate is just, let's see, 78 compared to the rest of the vaccine reports, which is 22. So yes, there are definite hormonal issues that are going on there. And I also advise everybody to read an article by Dr. Daria Kanduk. And I know I mentioned her the other night, but she's written a lot of articles. And this one here in particular is on HPV 16L1 protein and sudden death associated antigens. And what she shows is that there's such similarity when you look at these antigens that are associated with sudden death, and she actually lists them all out. I mean, to read through this, please read this before agreeing to get a vaccine. Please bring this in and discuss it with your doctor and ask your doctor to allay your concern.
One of the main reasons I want to go through this is for the young girls are being told by the parents, because they've spoken to the doctor, that if they don't have this vaccine, they will develop cervical cancer. So you get this whole taunting of young girls saying, you didn't have that vaccine, have fun having cervical cancer.
Right.
So there's a whole, the education on this has gone skew-if.
Well, that's why people need to listen to what we're saying right now.
Okay.
Because 7.9 per 100,000 people, women in the United States, will have cervical cancer. So how does that translate to, if you don't take this vaccine, you'll end up with cervical cancer? It doesn't make any sense at all.
But it's usual bullying
Right, just like if you're signing your child's death certificate if you don't take this DTaP shot. Meanwhile, what did the doctor end up doing with Bryce and Carrie Bundy? The doctor signed the death certificate, right? Because that's who signs death certificates, is doctors, not parents.
One of the things that stood out here was hypersensitivity and allergic reactions to yeast. Or if you've had any other Gardasil reaction from a previous vaccine. This is the Gardasil 9, don't forget. So how do you know with your 9-year-old daughter if she has, I suppose from eating bread and things like that, is that what we're taking it from? I mean, what's the level of yeast in here? For them to put it in there, no doctor's asking you. When you go in, you're not given a thorough check over.
No, they
and
won't
it's absolutely
ask that.
telling you not to have it if you have any sensitivities to yeast or the following. What have you got there?
Oh, this is just the background substances, but yeah.
And also, how
certainly.
dangerous is 500 mcgs of aluminium per shot, yes? Or aluminum per shot?
Well, I wouldn't want it. I've had hepatitis B vaccines. I've had vaccines. I've never had one that's 500 micrograms of aluminum, let alone 3 of them within a year.
I don't think they're going to know the real side effects of this vaccine for a few years to come. this is what worries me, is that you'll get a lot of Bella's friends who are they're 20 now, 21, that had it when they were younger, the original Gardasil, who say, I'm fine. They haven't started to have children.
Yeah.
So there is a chance. You're saying that some children will have this and be absolutely fine. Will have none of these at all. Will never have a side effect at all.
Yeah, I think there's a chance.
And you think that's the majority?
I honestly don't know, but at least in the short term, I think most people do okay in the short term. But there are enough that are not doing okay that we need to pay attention to this. I mean, we're meeting these people that are not doing okay, that were doing perfectly okay beforehand.
We're meeting people who are severely crippled by this.
That's
They
right.
can't have children, they're in wheelchairs,
They can't
they're having
stand up.
terrible seizures, and their life is pretty much over as it was before. They're not doing any sport, they can't go to school. It's horrific. And we've even had Colton, a young man, on a respirator. So serious side effects.
That's right. And it's all about risk benefit. You know, if you're comparing the rate of cervical cancer to the rate of adverse events, you're talking thousands versus 7.9.
I don't see as thorough in here as I did with the MMR2 that we went through. So I don't think they've done that. I don't think they've covered themselves. I don't think they had a clue how much damage was going to be done when they made these vaccines. And I cannot believe that they've gone from Gardasil to Gardasil 9 and doubling all these things that you're talking about when they know, the VARS report, the biggest amount of reporting right now is the Gardasil. So they knowingly know right now that the first one was causing trouble. So they up the game and put out another one.
Well, they're blaming, you know, they're saying that it's hysteria because it's teenage girls. That's one of the excuses that I've heard. I actually took this from a recording in Denmark because this quote was just, I couldn't pass it up. There's this thing about the HPV vaccine, that it has been given to a group of people who are actually capable of speaking and who can therefore verbalize what kind of adverse events they experience. That's this person that was being interviewed on the radio and said why he thought there were so many adverse events reporting. In other words, babies can't tell you, they can't say they don't want to get up and go to school. And so it's because these teenagers are actually able to tell you their experience, which is why we're seeing more adverse events.
We are also, we're hearing of deaths. I mean, serious, beautiful teenage girls and boys that actually die from this vaccine.
And that's why everyone needs to read Dr. Kanduk's article, because I think that explains to a large degree why that might be. Because so many of the proteins that are in the HPV particles mimic our proteins in our body, in our hearts, in our brains, in our vasculature, that when the body is trained to attack the microbe particles, it by accident attacks our blood vessels, our myelin, brain, heart, conduction system.
So how safe do you think this vaccine is? Would you ever give this vaccine to anybody?
No, never.
Would you ever recommend it to anybody on any level?
Well, you know, it's interesting because, you know, when the rates of cervical cancer are discussed in public, they're discussed as far as the worldwide incidence goes. And so most of the incidence of cervical cancer is happening in third world countries where, you know, nutrition is really poor, where maybe there might be more smoking, there's a lot of stress, there's not regular pap smear examinations. And so with those people, you could say, well, maybe it might be a good idea, you know, I don't think it's a good idea, but some of the rationale is it might be a good idea to give those. It's so expensive, though, that it's probably going to be a while before that happens in a lot of the really poor countries. But it's still never a substitute for getting pap smears. So when you look at that, no, I think it is much more cost-effective and humane to do a pap smear on a sexually active woman who's at risk for carrying HPV, which can turn those cells into precancerous lesions.
They've kind of covered themselves here because they say this is not, you need to have all your cancer checks. We're not saying this is actually going to get rid of your cancer.
It has expanded the period of time where women can go between cervical checks, though. So in other words, if you're a 26-year-old and you get tested for HPV and a pap smear and you're negative, you're then allowed to wait 5 years to get your next one, as opposed to if you don't get tested for HPV, it's 3 years. So it has extended the period of time that they're letting women go between, or they're advising, I should say letting, women can do anything they want, between those pap smears. And I like that they talk about not all vulvar, vaginal, and anal cancers are caused by HPV. They talk about the cause as if it's absolutely definite that you know, there's this causation because of the correlation. And the fact of the matter is that while it's true for the large majority, it's not true for everything. I want to make another important point because it actually has to do with the package inserts. So what I have here on the left is a torturous 464-page FDA document. So when Gardasil was developed, and they did all the pre-licensure testing using thousands of people, they had to submit their report to the FDA. So that's what this is. And what I want to point out is that in this 464-page report, that they refer to a saline placebo. And they refer to it on 12 different pages, more than 12 times. Okay, I'm going to show you one example here. So these are all the different study numbers. 1, 2, 4, 5, 6, 7, 13, 15, 16, 18 are the study. Those are the names of these. They basically number the different studies in the different areas. Well, number 18 is the only one that they say a saline placebo was used. You can see all the other ones, they talk about placebo equals 225 of aluminum, the AAHS. This one here, 450 micrograms of AAHS. Is that placebo? Does that sound like a placebo? Another one, 225 AAHS, and some of them had 450. So they mixed it up, they match it, and then here they say in D, right here, this trial here, they say that it was a saline placebo. Well, I went and got that trial. And here it is. It's by Reisinger here. I'll just pull up the first page. It looks like this, and I'm going to give this also to you guys. And you can post it on the website, and it talks about safety and persistent. This is the study, but see this one here, the FDA submission came out in 2006. This was published in 2007, so it's rather sneaky. So they said saline placebo, everything was cool. They passed Gardasil through. Then we see this, and when you scroll through it, what you see here is that they first referred to the placebo as a non-aluminum containing placebo. And here they refer to it as the placebo used in this study contained identical components to those in the vaccine, with the exception of HPV L1 virus-like particles and aluminum adjuvant. Well, what's left after that? What's left after that is what I was just showing you a moment ago, is this. So what I have here in the box, we're left with sodium chloride. All right, that's not a problem. L-histidine is key here, okay? Because when we're talking about blood pressure dropping, about anaphylaxis, please go read about L-histidine. Please read about that it's a precursor to histamine, which is one of the most potent and powerful vasodilators and anaphylactic reaction chemicals in the body. And so this is a precursor, and I believe that the reason this is put in the vaccine is because they wanted the blood vessels to dilate in that area so that there could be maximal activity at the site of injection. The problem is that it's put into this vaccine during the placebo study, okay? So there was no placebo. Every arm of these vaccine trials had chemicals in them that are going to have significant effects. And here you have polysorbate 80, which you can go ahead and Google the problems with that, and sodium borate, which I really can't speak to off the top of my head. But this is the background. This is what they were calling saline in this one. Clearly, that is not a saline placebo. So that's an outright lie, as far as I'm concerned. That's an L, capital L-I-E, lie. That is not a mistake. It is not a oversight, because they say it in 12 different pages. They refer to that particular study as a saline placebo, and I just showed you that it's not. So I think that's a really important take-home message from these studies.
But isn't this some kind of, this is criminal?
I believe that it should be criminal, certainly, but who's
yeah, who's in charge?
If anybody's out there and knows how to prosecute or bring this into a legal arena, please do. Well, I will supply you with all of this information. Okay, here's where they kept it separate. So the reactions that were just basically injection site reactions, they said, okay, we're going to show you the difference between Gardasil, between the aluminum control, and between the saline placebo. I actually do believe it was a saline placebo, but the thing is there were only like 300 people, and there were thousands in this one. But there's a definite difference, and you can see that only 33.7% had reactions after that. 57% after the aluminum, and 60%, 63% here. So there's definitely a difference. So whatever this was, maybe it was background substance. It wouldn't surprise me if it was background substance and not just saline. But there seems to be a difference, and this is what I want the take-home message to be to people that are listening, between the saline placebo and the aluminum control. Now, if you scroll down to the more serious reactions, what you find is that they combined control and saline placebo together. And I want to show you the amount of the numbers that they used here. Because if I'm remembering correctly, okay, saline placebo was only 320, an N of 320, okay? So only 320 subjects received a saline placebo, if it really was saline. 3,470 received aluminum, and 5,088 received Gardasil. Okay, so now if you're going to combine, this is very tricky, and this is how they do it. So if you're going to, and this is all in the package insert, this is the part that they're not putting on here anymore. They've condensed it down, they've dumbed it down a little bit here. If you're going to combine the aluminum control with the saline placebo, what's going to happen there? Are you going to be able to suss out when you combine 320 together with 3,470? No. This lack of adverse events in that small saline group is going to get lost, and you're not going to see the difference anymore when you combine them, and that's exactly what they did. If you go down here, you can see that they combined AAHS and saline together when they were looking at systemic autoimmune disorders. These are the more serious disorders that they looked at. They combined them all together. So you can go through and look at this yourself. And again, I'm going to give you guys the 28-page one.
It's wicked.
It is so wicked. And I thought this was interesting because this is another thing that I found in the 28-page one where it said that there have been reports of administration of higher than recommended doses of Gardasil, and they basically say that there wasn't a problem. But that's not true, because there was one section of the early study where some of the boys and men got more than 3 injections, and there were definitely more adverse events in those. So those are some things that I wanted to cover. And also want to say that these trials don't look to see who gets cervical cancer. They look to see who gets CIN 2 and 3, okay? A pre-cervical cancer lesion that 70 to 90% can resolve in 1 to 2 years. They're not looking, their endpoint is not looking for cervical cancer. So they have not proven that they have prevented 1 episode of cervical cancer yet.
I don't know how these things are allowed to be passed. I really don't.
This is science in today's world. In the longer document, I couldn't believe this when I saw it, actually. In the trials, they made sure that the subjects in a lot of these trials did not have prior HPV infection.
So they actually did that rather than what they do with
in real life. They don't check
life.
To see if you have
No one
HPV
checks.
before they give it. Here's another one where they checked the titers. That's what I'm trying to find. Is they looked at the titers over time. And titers are basically the blood antibody levels. So what they did is they looked at the geometric mean titers. That's how they described the blood level of antibody in 9 through 45-year-old girls and women after they were given the vaccine. So they break it up into the younger girls, the medium age, the older, and then older women. And then they show you the antibody titers. And what you can see here is that, look, let's just look at this in the 9 to 15-year-old girls. And we keep hearing that it lasts for 8 years, it lasts for 8 years. Well, it doesn't last for 8 years, because look at this when it comes to the HPV-6 titer. There's nothing left at month 48. That's 4 years, there's nothing left. And look how quickly it drops. 929 in month 7, 156 in month 24. Look at these numbers. 1,304 goes down to nothing, so it goes 1,300 to 218 in 2 years. Like, these titers are dropping like gravity. There's another scandal that I want to tell you about.
Please.
I wonder if I have it up here, which is that the Chinese are very upset right now, some Chinese people, because when they went to the Chinese government to ask for the data that I'm showing you, this kind of data, they were told that it was a trade secret and that it could not be given. And they said, this is a direct quote from the Chinese, equivalent of the CDC there. the information concerning clinical trial data you requested involves enterprise commercial secrets, so does not fall under scope of government information disclosure. Well, that's really interesting, because what they found in the original Gardasil that we know from the trials around the world is that there was one that was done, it was called Protocol 19. And what they found out with that is that all in all, there were 8 deaths during that period, and 7 out of those 8 deaths were Asian women. Now that, you might think that, oh, it was all in China, but it wasn't. Only 30% of the women in the trial were Asian, and 7 out of the 8 deaths were Asian. So what that tells me is there's probably some epigenetic effect.
Right.
And so this is why it's not a one-size-fits-all vaccine. And that, you know, it's just like with the, you know, the young African-American boys and the measles that were, you know, you guys have in your movie. Well, this is possibly an equivalent of that, in that Asians were more susceptible. These Asian women seem to have been more susceptible to dying in that particular arm of the study.
That's shocking. Okay, this is important. What are we going to do about it?
Well, we're doing what we can. I mean, I've been spending day and night reading through this stuff.
I know you have.
And talking to people that I collaborate with to, you know, get some understanding here and to bring this to you so that we can bring it to the larger public.
Are other doctors going to, we know there are other doctors that know, I mean, we've spoken to them on the road, that they will not have the Gardasil vaccine in their surgery or their clinic. They absolutely won't do it.
Good. What we need to do now is, you know, when women or men are listening to this and you are open-minded and you want to be inquisitive, please take the documents that we're showing you here and show them to your doctor, because the truth is, I don't believe that doctors are evil people. I don't believe that, you know, at that level that's where the weird stuff is going on. I think that the doctors are doing what they think is the best thing for their patients, and they think their patients are refusing based on mythology that you and I are propagating. So I think if people go in with this information and say, well, why do you think there were this many Asian deaths? And, you know, look at how the titers dropped after 4 years. How come we have only 7.9 per 100,000 for cervical cancer, but we had 2,300 adverse events per 100,000? I don't think that this is a good bet for me. What do you think, doctor? I'll give you these papers. Maybe you can go home and read about them. Maybe you can go to this same Vax where they have health professionals, a cardiologist who reported about his daughter who had a horrible adverse event. There are nurses on there, healthcare professionals, journalists writing real journalism that's telling another side that the CDC isn't telling. So I think that if people go and present this information to their doctors, I think this is the one vaccine where doctors are going to be more open to, and I found that my colleagues at my job were much more open to the problems with this vaccine. And one of my colleagues said to me, I just followed the money trail, and he wasn't willing to vaccinate his own daughter with this particular vaccine. And once people start to have a healthy skepticism about one vaccine, then I think that they will start having a healthy skepticism about all kinds of biologicals and pharmaceuticals, and at least read about them before you accept them. I'm not saying not to accept them. I'm saying just understand what you're doing, because walk around the bus, the Vax bus, and look at all those injuries and deaths that have happened out there with parents who are in deep mourning, becoming activists, and wish they could undo it. You can't undo it. Luckily, some people are able to do some resuscitation of their kids, but you can't get that vaccine out once you put it in.
And the seriousness of what we're seeing with this Gardasil vaccine is truly horrific.
It's really serious. And it's at such a young age. You know, we're in the prime. You know, these kids are graduating high school or they're going off to college, and
everything from the people that we've interviewed, everything is taken away from them.
Yep.
Everything. So.
Yep. There are numerous reports about boys who are unable to maintain an erection, and I guess their girlfriends didn't love them all that much, because a lot of the girlfriends are leaving them after that happens, and of course their self-esteem goes to the basement. Suicidal ideations start to occur. It's one thing after the next.
All right, so people need to do research. Here it is. You've seen it here. We've got
Please
the videos.
research. I'm not telling you not to get vaccinated. I'm telling you to listen to what we've
Do your
just
work.
outlined to you.
Yeah.
Go and take these. Look, this is all it is that I'm basically going to be giving to read. You could read this. The average person could read this in probably 4 or 5 days. I have a list here, and it's not in order of importance by any means, but there's a doctor named Dr. Deirdre Little. I believe she's Australian, and she's done a lot of speaking and writing about premature menopause in girls. There's Dr. Diane Harper, who is a practicing physician who was part of the original Gardasil trials. She was one of the conductors of the trials. She had to step away. She said her conscience could no longer allow her to be part of it because while she is still pro-vaccine, she believed that there was the risk-benefit ratio of this vaccine didn't favor using it. There's Dr. Chris Shaw, PhD, and autoimmunity, aluminum, and brain information. Basically what they did is they got samples from one of the girls that died in New Zealand and examined the brain and the spleen, and have numerous publications about that they found the virus-like proteins and the specialized aluminum in the vasculature, and that they think it was autoimmunity. Dr. Lucia Tomljanovic, who has done numerous, they work together, Dr. Chris Shaw and Dr. Tomljanovic. Dr. Scott Ratner is the cardiologist that I referred to, who has done some video with talking about how his daughter had severe problems after her HPV vaccine. And then there's SaneVax, and what they do is they measure up to common sense criteria. They say safety, affordability, necessity, and effectiveness. And that's really what you should look at for every vaccine. And I just want to end by showing you a picture. And I want to tell you one last thing, and you guys can take this out if you want to, but I think this is a really telling picture, because when you look at a vial of Gardasil, what you see is a very pure looking, looks like the purest water on the planet. And when you look at it under electron microscope, this is what you see. And there's the link where I got this from, and this is just an independent, organization that does the microscopy. But what you're looking at here, the circles are the virus-like particles. And the backgrounds, all this, use a Yiddish word here, schmutz, in the background is the amorphous, meaning it doesn't really have a consistent shape, aluminum hydroxyphosphate sulfate. And so this is what it looks like in an electron micrograph. And another interesting thing that I found when I was researching is that Merck's recent patent talks about the reliability of uniformity of this mess inside of each vaccine after production. And what they talk about it in terms, they call it, that they said aluminum AAHS, I'm just going to say that now, does not have a fixed stoichiometry. Well, what is stoichiometry? It is the relative quantities of reactants and products in chemical reactions. In other words, like I said on the bus, it's not like counting out jelly beans or pills when they make these vaccines. They can't say, I'm going to give you 100,000 and give you 100,000 and give you 100. You end up with something like that. And a prominent doctor who does a lot of the research in this field has said that it's like tossing tennis balls into barbed wire. And that's really what you end up with. It gets kind of physically trapped in there. And then you end up with a wide range. And even Merck says, and I'm going to give you a link to this as well, because this is the patent information. And it's all right here. Everything I'm about to say is right here. Merck says, there is poor particle size uniformity. These variations can present consistency problems for the commercial sale of vaccines. What is needed are more robust and reproducible methods for the manufacture of aluminum use as an adjuvant. The typical particle size range of the adjuvant aggregates following precipitation is from 2 to 40 microns. It's a pretty big spread there. And so they're basically saying, look, we have this, this amorphous aluminum hydroxyphosphate, and it's not uniform. And my interpretation of that is that you can end up with different amounts in different vials, and that they're saying, well, as long as it's within this range. Well, how do you know that it's okay within that range? It's a very inexact science when you think of it that way, when you look at that picture there. And you don't always know what you're getting. When you're getting
it's a mess, is what it is.
Yeah. I think that this is enough to give people something to think about. By no means did I cover everything here. I probably covered like 1/10 of what I probably could have covered if I had a couple of months to go through this.
You have got some YouTube videos, haven't you?
Yes.
Going into a little bit more detail, a lot more detail. So, and that's on your YouTube site.
Yes, yeah, it's on my personal website page, which is drsuzanne.net, and it's on my YouTube page, and it was a talk that I did in Sweden. It doesn't have all of this information, but it has some other information that I didn't talk about.